Hi, Dr. Chris, welcome. I have another video that I want to share that can help you take control of your health naturally. Today I want to talk about compromised joints, weak joints, for example, and exercise. What can you do to strengthen your joints? Say if you got arthritis or herniated discs or tears, for example, in hard tissue like tendons, and you want to do things to try to strengthen the joint. Hopefully you don't need surgery. That's something that you would need to talk to your healthcare provider about and get advice directly. But I just want to give you an alternative idea for working with weak and compromised joints. And there are 2 points. When there's a weak joint, you want to strengthen the muscles around the joint without a lot of movement and force. And then the second point is to loosen the joint. Joints need to move. For joints to be healthy, they need to move. They don't have to move with a lot of force or weight. You can just kind of wiggle them and loosen them. In Tai Chi and Qigong, we have exercises focused on joints to loosen the joints, because we know those are areas in the body that tend to block circulation. Good health is about good circulation, so keeping the joints limber and loose will help to promote good circulation. Okay, but with a weak joint, you can't do strenuous exercise on it. You may injure yourself. So if you have bad knees, doing lunges or doing knee bends could cause more injury. The better idea would be to say, for knee joints, you squat down a little bit, bend the knee a little bit, engage the thigh muscles, strengthen the thigh muscles, and that will strengthen the knee. Don't let your knees go past your toes. Strengthen the thigh muscle and just hold that position. You could shift from leg and hold, leg to leg and hold that position. It's just a little bit of your body weight on one leg, and strengthen the muscles that way. And then as far as moving the knee joints without weight or a lot of force, you could elevate your leg. Maybe you're sitting in a chair and you just bend the knee back and forth, extend the leg, bring it back very gently. You can do it slowly also, and that will help to move the joint without a lot of force and a lot of weight on it. You can do similar things with the back. The back I like doing when there's patients that I have with herniated discs, for example, or any weakness in the joints. What I like advising patients to do is bridging and planking. These are exercises where there's no movement on the back. It's just tension. All the core muscles are tight and tense, and you hold that posture for a while, and that will strengthen the back. If you're trying to understand what bridging and planking is, I would just basically say to look that up on the internet. I'm not going to focus on that here. Or you can call me, come in for a consultation, and we can talk about exercises particular for your health needs. So bridging and planking for the back. And then as far as loosening the back, you can do simple circles like this. Okay, just to kind of loosen up the back and help the joints to move a little bit without a lot of force and a lot of weight. Think of the back as a pole, and the hips here, and as that connection, we want to rotate that. Think of circles. Go counterclockwise slowly, then clockwise slowly. Okay, and so you reverse the circle, right? And that will help to exercise the back and loosen up the back. So you get strengthening and loosening as techniques. Say, for example, the shoulder. You don't want to do a lot of strenuous exercise to strengthen the shoulder if you have a compromised joint. So you could do something simple by holding the arms out a little bit. That'll create tension in the deltoids, and that will help to strengthen, keep those muscles strong. Okay, you could also do some gentle movements like circles, for example, to help loosen up the joints. Okay, not a lot of weight. We're not holding on to weights or doing a lot of force, strenuous force. We're going very gently. Okay, so again, compromised joint, don't put a lot of strength and force on it. You want to do exercises that tighten the muscles around it without a lot of movement. Okay, you don't want to move the joints in a forceful way. So you kind of like an isometric, where you just kind of stay stationary and tighten the muscles around the joint, and that will help to strengthen the joint itself by keeping the muscles strong. And then the second point is to loosen that joint in a gentle way, again, without weight or a lot of exertion. Okay, so like for the wrist, just doing simple circles. Your carpal tunnel, that might be um, a more difficult issue to deal with, but you can try to avoid actually doing a lot of computer work. Try to find ways to modify that and do a lot of loosening and massaging for the joints and the tissue around the wrist joint, for example. So I hope this helps. If you have questions, leave comments below and questions. I'd be glad to engage and help you, keep you on a path to good health in a natural way. Something I have a passion about, and I want to share. Have a good day. Thanks.